are going to discuss insulin. So insulin in pharmacology, it is very important hormone. What you should be knowing about insulin, first is route, by which route we give insulin. So remember always insulin is never given orally. It is never given orally. Why? Because it undergoes enzymatic cleavage in gut. So it is not given orally. It is given by subcutaneous route. It is given by subcutaneous route. So what are the sites of subcutaneous route where you will give insulin? We can give this in anterior thigh, in upper buttocks, and in arm, in upper arm. These are the some sites. We can also give in abdomen, in periumbilical area. So most common site of giving insulin is thigh. Most common site of giving insulin is thigh. The fastest absorption of insulin is seen when it is given in abdomen. So fastest absorption occur in abdominal route, but most common site is anterior thigh. This insulin, while giving injection of subcutaneous insulin, it causes a side effect. This side effect occurred due to repetitive injection use. It is called lipodystrophy. So side effect of this insulin on injection, it causes lipodystrophy. So there is a classification of insulin. We classify this insulin based on its duration of action. Based on its duration of action, we classify this insulin. First is ultra short acting insulin. Ultra short acting insulin. Second type of insulin is short acting insulin. Short acting insulin. Third type is intermediate acting. Intermediate acting. Then we are having a longer acting insulin or long acting insulin. Then the last type we are having a very long acting or ultra long acting insulin. A very long acting or ultra long acting insulin. This classification is based on duration of action. In ultra short acting insulin, it includes Lispro, Aspart, Glulysin. Lispro, Aspart, Glulysin. These are ultra short acting insulin. In case of this ultra short acting insulin, remember all these ultra short acting insulin are having S in their name. All they are having S in their name. Then we are having short acting insulin. The short acting insulin includes regular insulin, semilente, regular insulin and semilente. This regular insulin is the only IV insulin that is available. This is only insulin which is available in intravenous form. Intermediate acting insulin, it includes NPH and lente. NPH cis neutral protamine hagidrone and lente. This long acting insulin includes ultra lente, it is a longer acting insulin, where ultra long acting insulin includes glargine, detemer and degludec. Glargine, detemer and degludec. These are ultra long acting insulin. So this is a classification of insulin. What is my advice? At least remember ultra short acting insulin, ultra long acting insulin, and this regular insulin which is given as IV route. So how to remember this ultra long acting insulin? They are having large in their name. This is ultra long acting insulin. These are ultra long acting insulin. Something more about this insulin. These insulins are used in many conditions. So what are the uses of this insulin? The first use is it is drug of choice or treatment of choice in type 1 diabetes. In type 1 diabetes mellitus we use insulin. Second use of insulin is it is used in emergency condition. We use insulin as a treatment of choice in emergency condition. This emergency condition includes diabetic ketoacidosis and diabetic non-ketotic hyperosmolar coma. This insulin is also used as a treatment of choice in refractory diabetes type 2. Refractory or resistant type 2 diabetes mellitus means that diabetes mellitus type 2 which is not showing any response with oral hypoglycemic agents. Here also we use insulin. The last important use of insulin, remember insulin is also a treatment of choice in pregnancy. In pregnancy we avoid giving drugs, so insulin is a hormone, it is preferred agent. So remember these are uses of insulin. It is used in type 1 diabetes mellitus, in diabetic ketoacidosis, in diabetic non-ketotic hyperosmolar coma, in refractory type 2 diabetes mellitus, and in pregnancy. A last use of insulin that you should be knowing, it is not a use related to diabetes, it is also used in treatment of hyperkalemia. It is used in the treatment of hyperkalemia. We use here IV insulin. So as you already know, IV insulin is regular insulin. We use regular insulin with dextrose. So why we are giving dextrose? It will cover the hypoglycemia that is caused by insulin. To compensate this drawback, we are using dextrose. So these are the uses and types of insulin that you should be knowing. Nowadays there are two more types of insulin which are under trials. These two insulins are Afreeza and Exubera. Afreeza and Exubera, these are two new forms of insulin which are called inhalational insulin. These are given by inhalational route. Due to their inhalation route, they are having a side effect. These insulin, they produce cough. So what are the side effects that is associated with insulin use? So insulin use can lead to a lot of side effects. Most common side effect that we see with insulin is hypoglycemia. Most common side effect of insulin is hypoglycemia. The second side effect I already told you, it can lead to lipodystrophy at injection site. Lipodystrophy. Third side effect with insulin is it is also causing weight gain. Insulin causes increase in weight. And the last side effect of insulin is it can lead to hypokalemia. Hypokalemia. The most common side effect is hypoglycemia. This is side effect of insulin that you should be knowing. So this is insulin, an important topic, classification of insulin. You can see this diagram for better approach of this insulin. This is a diagram based on duration of action of different types of insulin. First you can see this aspart, lispro and glulysin. These are ultra short acting insulin. Then we are having regular insulin, NPH, and these detemer and glargine, which are ultra long acting insulin. So this is insulin important topic.